Good afternoon. Welcome to Special Report for Wednesday, September the 16th. Thank you very much for joining us this afternoon. Thank you to KC Securities for your sponsorship. We are waiting for Doug Ford's press conference to start in just a few moments. He's going to be joined today by Christine Elliott, the Deputy Premier and Minister of Health, Stephen Lecce, the Minister of Education, and Peter Bethenflavi, who is the Minister of the Treasury Board. That's going to start shortly from Queen's Park. But before we head down to Queen's Park, we are going to go to Weather Daniel. What's going on, buddy?
Much, Chris. Good afternoon, everybody. On Wednesday, September 16th, we're cruising right through September into the second half, and we're going to see temperatures dip a little bit overnight, but we got a lot of sun coming up. You're going to see a live look now at the wirelesscom.ca camera, which is sponsored by them. Check their website out for all the services that they have to offer. We are seeing clouds today with a chance of a shower lingering around, and we will see things cool down as we get into the overnight. But we're going to take a look at the radar first, and you'll see on your screen there we have a low pressure system that's just above us that's moving through. Winds are going to move things through very quickly, and once it does, we're going to be into high pressure and lots of sun. However, the caveat for that is it is going to be cool out for the next little while until next week, and then we will slowly creep back up once again. So your expected highs for our region today, 16 in Thunder Bay, 15 in Wawa, 13 in Timmins, then 19 here in Sault Ste. Marie, as well as in Elliott Lake, and then 18 degrees in Sudbury. Get ready for those overnight lows. We're going to probably have some frost warnings issued again throughout our region. We have 3 degrees in Thunder Bay.
Sorry about that. We got to cut into the weather. We're going to go over to Doug Ford's press conference from Queen's Park. Here we go.
Well, good afternoon. Over the past several months, our government worked hand in hand with our Chief Medical Officer of Health and the best medical experts to develop a comprehensive back-to-school plan. Our number one priority is the health and safety of our students, teachers, and staff. Public health units across the province have completed the hiring of over 500 additional nurses for our schools, and we're well on our way to hiring the full 625 positions. Schools are focused on hiring up to 1,300 cleaning staff and up to 2,600 additional teachers and education staff. We've put in $1.3 billion in critical supports, more than any other province in the country, for ventilation, staffing, PPE, cleaning supplies, mental health, and remote learning. We're continuing to deliver critical supplies to schools throughout the province. We've delivered over 37 million pieces of PPE, that's 19.5 million face masks, 16 million gloves, over 300,000 face shields, and much, much more. These are the tools that will help stop COVID-19 in its tracks and contain the spread. And we heard from parents, educators, that they need more help identifying symptoms and managing cases. So we are providing that support. Today, I'm here to announce the launch of our new interactive COVID-19 screening tool for students, parents, and teachers. It's free, voluntary, and easy to use. It's now available on our website at ontario.ca/COVID-19. That's ontario.ca/COVID-19. Please use this tool to help with screening your child for symptoms before they go to school every day. Teachers and school staff should also use this tool to screen themselves before they come to school. If someone is sick, even with mild symptoms, they should stay home. It's absolutely critical. And I believe that our parents need to see the same information I see. I want them to know what I know. That's why we launched a new online case tracker for our students and child care centers. This webpage is updated every weekday, so you'll know if a COVID-19 case is confirmed at your school. Our provincial lead for managing outbreaks is Dr. Heyer, and his team are working with schools and local public health units to quickly isolate and contain cases. I also want to share a message with all of our employers out there. Please show some understanding and patience for your workers, to parents who are juggling work and getting the kids back to school. We want everyone to put health and safety first. We need parents to be able to pull their kids out of school anytime if they're showing even mild symptoms. My friends, by working together, we will get through this. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Lecce.
Well, good afternoon. There is nothing more important than the safety of our kids. Whatever path COVID-19 takes this school year, we are ready. In these early days, we are already being tested, and local public health and school boards are acting decisively. Our school reopening plan, supported by the Chief Medical Officer of Health, is comprehensive, it is nation-leading, fully funded, and evidence-informed. And we have two aims. The first is to prevent the spread. To help mitigate the risk, we were the first province to call for mandatory masking in class from grades 4 to 12. We've placed our students in cohorts, staggered re-entry to our schools. We provided clear markings in school to reduce contact. We've increased hand hygiene routines. We require screening before entering schools and ongoing work to improve air quality. We're hiring, as the Premier noted, new cleaning staff, thousands of new educators. And we are more than doubling those public health nurses in schools that are working with educators and our kids to exercise the highest degree of caution and responsiveness. And we have money set aside to respond to the flu season. The second objective is to respond swiftly when cases emerge. And I know it's unsettling to see. However, public health's capacity to respond, their immediacy, their focus on the care of our kids only underscores the fact that the outbreak protocol is working. To support our response and stay on the offense against this virus, we're building up our testing capacity, focusing on asymptomatic high school students in areas where we know the risk is more active. Our government has always believed in putting families first, and that's why we worked around the clock to launch a website, as the Premier noted, that informs you of school and childcare specific COVID-19 data, because we believe what parents deserve to know what we know. It's also why today we are launching our voluntary interactive COVID-19 screening tool. It's just another step we're taking to improve the safety of our schools. Parents, students, and staff will be able to go to www.covid-19.ontario.ca/school-reopening to answer a few questions and get some clear instruction on whether they should attend school that day or not. Again, I'm encouraging Ontarians entering schools to use that tool at www.covid19.ontario.ca/school-reopening. And to reiterate, if you are a staff member or a student, if you have COVID-19 symptoms, please stay home and seek public health advice. As we continue to respond to COVID-19, know that we will put our students first. However, we can't do this alone. Only together we can reduce the risk in our communities and in our schools. And that's why we cannot let our guard down collectively. I want to thank the people of Ontario for your sacrifice. Our work continues as a province, but I do remain optimistic that we will overcome these challenges as we always have. Thank you, and I'll now turn it over to Minister Bethan Thalby.
Thank you, Minister Lecce, and good afternoon, everyone. As the Minister responsible for digital and data transformation, delivering accessible, reliable, and convenient access to vital programs and services to the people of Ontario throughout the pandemic has been a critical part of our process. So I'm pleased to join Premier Ford, Minister Lecce, Mr. Elliott, and Dr. Heyer to unveil the latest example of how we're leveraging Ontario technology and innovation to keep Ontarians safe and healthy. Today, we're launching a new, innovative online tool that will help parents, students, and teachers stay safe in the classroom. This 100% voluntary online tool makes it easy to screen for symptoms of illness before entering a school. Aujourd'hui, nous lançons un nouvel outil en ligne innovant qui aidera les parents, les élèves et les enseignants à s'assurer la sécurité en classe. L'utilisation de cet outil en ligne est entièrement volontaire et facilite le dépistage de symptômes de maladie avant d'entrer dans une école. Together with masks, physical distancing, hand washing, our COVID Alert app, which I've got right here, I always like to brag about it. It's right here, it's so easy to download, and our webpage, our school screening tool is one of the many tactics we are using to combat COVID-19 in our classrooms and in our communities. We encourage all Ontarian parents, students, and teachers to take advantage of this tool. As everyone stayed home and did their part to help flatten the curve and slow the spread of the virus, our government has worked swiftly and safely to make Ontario's programs and frontline services more convenient, more reliable, and more accessible. That means collaborating across the whole of government to harness technology and offer more programs and services online. So with our Ontario Digital Service leading the effort to improve service delivery, we are making a government more responsive to the dynamic needs of the people who rely on them every day. These ongoing efforts will help keep students, teachers, and families across our province safe and healthy. It's part of our vision to build a smarter government that's working for you. Thank you.
Okay, we'll go to the phone line for questions. First question, please.
Your first question comes from Cynthia Mulligan with City News. Please go ahead.
Hi, Cynthia.
Hi, Premier.
Hi.
Go ahead, Cynthia.
How you doing, Cynthia?
You have been saying for a while that you're concerned about the long lineups at assessment centres and that your government is going to make an announcement soon. We heard in the legislature today one NDP MPP saying that one of his constituents faced an 8-hour lineup. Can you give us a firm timeline on when people can start to expect to see smaller lines? Because testing is one of the pillars of battling COVID-19.
Absolutely. So, Cynthia, first of all, thanks for the question. You know, I stood up here for weeks, if not months, begging people to go get tested, and one good news when I drive by the testing areas, and just as you saw down at Women's College, people are lined up. The other positive news is I saw a lot of young people in that lineup today when I drove by. But in saying that, for the last couple of months, we've been ready. We're ramping up to get the private sector involved, and we've been communicating with them over months now. So they're going to be ready, and we're working out a few details with the private sector. But you know what I love, Cynthia? When we've called out for help, and we called out for help again, it's like the private sector coming over the top of the hill like the cavalry and helping us out. So we'll have thousands of testing areas once we cross the T's and dot the I's for the retailers to go out there and do the testing. I'm so grateful. And I'm not going to rattle all the names off, but all the major retailers in this country have stepped up. They're ready, and they're ready to go. So it's going to be very soon. And we're just all over this right now. I've been communicating with every single CEO out there, and they've been working on this, I said, for the last couple months. So they're prepared, and just very short period. I just can't give you the exact day, Cynthia, because I don't want to give you a different day if it happens a couple of days later. But we're ready, they're ready, and we're just going to ramp up the testing like you've never seen before.
Follow up?
My next question is for my colleague Brandon Rowe. And we've been getting a number of complaints of hydro companies that have been hiking their rates during the pandemic, even after you said there would be some relief. And what are your thoughts on that and your message to the people you said you would help with this situation during the pandemic?
Yeah, so we've helped people throughout the province in making sure that we maintain the rents, making sure that they're off-peak hours so they can do the washing and cleaning off-peak hours, opposed to what happened before. We saw the bills jump up if you were at home using any electricity. We're talking to the Minister of Energy. I'm always going to protect the little person per se, or all people, including businesses out there, to maintain the rates, and as long as we can, the off-peak hours. It's absolutely critical that small businesses, large businesses, and households are able to maintain the electricity rates that they have, and use them when you want. You use your dishwasher, use your washing machine. I always tell the story that I've talked to so many people, and they'd have to come home from work, a long day at work, wait till 8 or 9 o'clock at night and start doing their washing. They don't have to do that any longer, and we're going to maintain those rates as absolutely as long as possible. So there's a lot of relief there for the people.
Next question.
Your next question comes from Lucas Meyer with News Talk 1010. Please go ahead.
Thank you very much.
Hi, Lucas.
Premier, in terms of the multiple reports we're seeing about the restrictions we're going to have for Toronto, Peel, Ottawa, etc., I understand these are obviously being discussed. But in terms of what you might do around gatherings, is it just going to be around things like parties and weddings, things in your backyard, or is it going to also involve limits in bars, restaurants, gyms, other businesses? And are you going to bring in fines the way that Quebec has to enforce these and bring these numbers down?
Well, I'm bringing this to the cabinet right after our press conference here. We'll have a good, wholesome discussion. I also, and I never make a move on anything unless I get being consulted with the chief medical officer of that region and the mayor. Those are two key priorities, and I've talked to the mayor of Mayor Watson in Ottawa and Dr. Edges from Ottawa, and I'm going to be up there Friday, by the way, to have a face-to-face conversation with them, along with the Peel region. The mayor's there. I'm meeting Bonnie Crombie tonight, met Patrick Brown the other night, along with the chief medical officer, and I just got off the phone again, talked to him frequently, Mayor Tory, along with their chief medical officer as well, and I'll always follow the guidelines of the health and the science. And when they ask something to be done, we're usually 99.9% of the time we're all on the same page. So when we're all agreeing on policies and guidelines to be put in place, we act quickly, and we're going to act quickly on this. And yes, there will be fines, and I'll give you the number hopefully tomorrow. But there's going to be some severe fines for people want to ignore the regulations and the guidelines. So it's going to be severe. They're going to be the highest in the country, and they're going to be under provincial jurisdiction. It's not going to be under federal jurisdiction. So we'll make sure that they're followed through.
Follow up.
Thank you very much. And my next question is actually for Minister Elliott as well as Dr. Heyer, since you're there. It's important to keep in mind, obviously, these increased cases represent stuff often going on a week and a half, 2 weeks ago. What is the expectation going to be for a week from now, later on in September? What do the models say the cases are going to be?
So what I'll do is I'll pass it to the minister, and the minister can hand it over to Dr. Heyer. Thank you.
We have been watching the numbers very carefully, and of course it is concerning to see the numbers continuing to go up. We have several different modeling scenarios that have been presented to us, from one that's just sort of a small up and down surge to one where there's more peaks and valleys, and then there's another one that we are preparing for, which is the worst of the three scenarios, which is a large spike in cases. So we have a plan in place. We are ready to deal with it, to deal with hospital capacity, to deal with testing, to deal with lab capacity, to make sure we can continue with the surgeries and other procedures that have been postponed since wave one, and to deal with health human resources. But with respect to the numbers that we can expect and where we expect to be in the next week, I am going to turn that over to the expert in this, Dr. Heyer.
Afternoon. Thanks, Minister Elliott and Premier. I don't think we know right now what the numbers are going to be next week, and it's difficult to predict. I can say that we've seen increased numbers, and that's very disappointing and frankly distressing, as it is for everybody. I want to take this opportunity to recognize the importance of all of us doing our part to take steps to be aware, to think about what we're doing, and to take the opportunities to prevent transmission, prevent infection. And if you think about it from a rubric of before, during, and after, people are going to make decisions about things that they're going to do. And within that decision, they need to think about the risk that they may be putting themselves into, but others into as well, when they're making their decision. People will have gatherings, people will get together, but people need to think about how many people will be there, what will be the chances of transmission, what will be the potential difficulties that can arise for themselves or others. So that's the before, weighing it out, thinking through what could happen. Then there's the during, and the during is wearing the mask, washing your hands, making sure that you've got physical distancing, thinking about things that you wouldn't thought of before, clinking of glasses, sharing of glasses, passing things between each other without washing hands in between while you're eating with your mask off. All of those things need to be thought of as the during. And if something happens, and if you do get symptoms, that can happen. So that's the after. What are you going to do? Stay home, get tested, get health care, and stay away from others so that you can't take that chance of infecting others. So this is an opportunity to think, to rethink, refocus on those things that we need to do together, all of us, to be able to reduce the chance of infection, reduce the chance of spread, reduce the chance of continuing along the pathway of increasing numbers. Thank you.
Next question.
That's great. Well, first of all, thank you. I think everyone needs to listen to the doc. He's a champion. Call him Dr. Dirk, but Dr. Heyer. But folks, you got to all listen to the doc there.
Okay, next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. Just back on the testing lines. I mean, you're talking about how much you're ready for this and you're getting the private sector involved. But I mean, all you have to do is look at the pictures of what's happening in Ottawa, Toronto, London, with long lines snaked around the block for hours, people getting turned away. So you knew school was coming back. You knew people had to get back to work. Why does it seem like your government is completely caught off guard by the demand right now?
Well, Laura, again, I'm going to have to respectfully disagree with you. We weren't caught off guard. We had some of the lowest cases. We were under 100 for weeks, and literally overnight, as I was mentioning up here numerous times, the second wave is coming. We're prepared to get everything ramped up in a matter of days that we're doing. We've done an incredible job with the private sector. So we're ramping up as we had some bumps in the road on all the other occasions. We're going to have this up and going. We're going to have more testing areas than anywhere in the country, bar none. Not a couple hundred, a couple thousand additional testing areas to make it convenient for people. But when you're coordinating with the private sector, no matter if it's the largest chains, be it the Rexalls or the Shoppers or the Loblaws or the Walmarts, everyone's coming to the table and coordinating with each and every one of them. And even working with them a couple months ago, we still need a few days to get ramped up and ready to go. But they are ready. They're ready to go, and it's going to happen real quick. And I am happy, Laura, that people are getting tested. As I say, from one day to the next, you'd think a bus came along and dropped hundreds and hundreds of people off. But I'm happy that people are now getting tested. And we're ready, and we're going to have the resources and give the people the tools to get tested. I'll pass the balance over to Minister Elliott. Thank you.
Well, we have ramped up our capacity significantly since the early days when we were only testing around 5,000 people per day. Now it's regularly 25 to 30,000. We're moving up to 50,000 and then again from there. But as the Premier indicated, we are working with partners in the community, other organizations and facilities to be able to open up more places where people can be tested. But also, as we're doing that, we're also working with groups that Ontario Health has brought together that have mobile testing units. So we are bringing them into some of the areas where we're having the most difficult problems, being in London, Toronto, and Ottawa areas, so that we can immediately relieve some of that congestion as we're waiting for some of these other online partners to begin their tests as well.
Follow up?
And Premier, we just heard Dr. Heyer talk about gatherings being inevitable and having to think about our behavior when we're there.
Yeah.
When we have people over, should we be wearing masks all the time? I think the public is rightly confused about this, and I think they've been drawn to some evidence or examples of your own behavior. You haven't addressed this yet. There's a photo of you on social media at a wedding this summer, standing at a table without a mask. You've had Premier François Legault over to your house for dinner. Patrick Brown said he was at your house the other night. Can you address these instances, and do you see this as sending a conflicting message to the public about what is and is not allowed right now and what will help stop the spread of COVID-19?
Well, again, Laura, I'm going to respectfully disagree. That wedding I went to, Stan chose, all the protocols were followed. Every single person in that room had a mask. They got their temperature taken. If I stretched my legs, I stood up from the table and I didn't have my mask on and then sat back down. Wandering around that room, everyone had their masks on. But in the other areas, I just ask people to practice the golden rules, and vast majority, Laura, are practicing them. They're putting the masks on, but there are small groups, very small percentage of the population that are ignoring the protocols and the guidelines. They're holding these big social gatherings, and that's what I'm hearing. No matter what chief medical officer I talk to or our health team, it's a social gatherings of large groups. Not if you have 1 or 2 people over. At any time, and by the way, anytime I'm with anyone social gathering, I always make sure we maintain a 6-foot distance with anyone. So I'll pass this over to Dr. Heyer. Thank you.
Hi, Laura. I think that's a really great question, and I think what I've heard from a number of people is that there is sometimes confusion between your own social group and then socializing. So what Dr. Williams has said and others have said is that you need to have a small group of people and family members that you have intersection with. But when you're having other people over, you're sharing their social group as well, or the group that they reside with or live with. And I think that's a really important distinction that's really crucial to think about when you have other people over. And so we'll go back to what I said before, which is the before, during, and after. The before is thinking about those social groups or the groups that person hangs around with, if we want to use a different terminology, or lives with, and then who they, within that group, hang around with or live with, and then the intersection when you have a gathering at a personal level. Then the during is what you talked about, which is, as Premier Ford pointed out, staying physically distant, 6 feet apart, and when you're closer, then the masking is important. But again, equally as crucial is thinking about the hand washing and making sure that people don't come in or don't go in when they might have symptoms. So all of those things are important, and when you are inside and you are within a physical distance that doesn't permit a fair distance, then the mask should be on.
Next question.
Your next question comes from Natasha McDonald with Radio Canada.
Hi, Natasha.
Hi, my question is for the Premier.
Yes.
I've got another question on lineups for testing from my colleagues at CBC Toronto. I'm wondering, have you considered temporarily restricting testing access to immediately relieve lineups so those who need to be tested get priority over those who have had no exposure or no symptoms?
Yeah, that's a really, really good question. That has come up. Is too many people going in line that really don't have symptoms and they're nervous, they're anxious. So that's a great question. No, we have not told the public not to go get tested. Again, making sure the message is clear. But the people that are even asymptomatic, once the retailers get up and going, very, very shortly, by the way, then they'll be able to go in there. And that's the message. Might as well get it out right now. Once these retailers are open for testing, I want to emphasize it's for asymptomatic people to go get tested. What that will do is take the weight and the load and the burden off the public system for people that really have symptoms. So again, to be very clear, go to the testing centers if you're showing symptoms. And if you're anxious, you're nervous, you might have something that tells you may have it but you aren't showing it, then go to the retail outlets, and they're going to be spread everywhere right across the province. We'll have a couple thousand areas that you can go to, so we'll cover every corner of this province. I want to give a shout out again to the chief medical officer and his whole team, all 34 of them, along with Matt Anderson at Ontario Health, Dr. Dirk for being out there and leading the way in testing. We've tested over 3,200,000 people. That's a lot of people. We're averaging upwards to 30,000, as the Minister of Health has mentioned, and this has been in the plans for the fall approach when we're here, is to ramp it up to 50,000 people a day. I don't know if people can comprehend that. That's a lot of testing, 50,000. And then once we hit the 50,000, we're going to start moving upwards as high as we can go. And we're going to lead, again, the country in testing. It's all hands on deck. Everyone's ready. And we'll get through this like we've been able to get through everything else.
Follow-up?
For my follow-up, have you considered Quebec's color-coded system, so by which different regions are classified green, yellow, orange, red, so tracking, testing, confinement measures can be communicated and implemented regionally?
Yeah, actually, that came up in conversation. I'm a big believer in just simplifying it, color coding. I think that was a great idea from Quebec. I will be meeting Premier Legault on Friday in Ottawa to discuss that program. I believe in not reinventing the wheel. If something works in one region of the world or one region of the province, let's bring it here. And this is another question for Dr. Heyer. He's heading up all the testing or outbreaks, I should say. So I'd like to get his opinion on color coding certain areas. But it's simple. I love the question because it's very simple. People can tell as soon as you see it, red, green, or yellow. So great question.
Thank you for that question. As part of my role working with a number of senior leaders within the government to help to have a provincial view of outbreaks across the province, we have had discussions about potentially characterizing different regions based upon specific measures, and there's a variety of measures that we're thinking about and considering, but we are working specifically on this topic and really trying to have a way to consider a number of factors. It's not a single one because there are many individual factors that are relevant within each particular region. There's results of testing, there's the makeup of the individual public health unit or city or town. There are a variety of different things that need to be considered, and so yes, that is something that we're looking at. Don't have that complete at this point, but in the works.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, Rob. How are you doing?
Hello, everyone. Premier, you might want to pass this one on to Dr. Heyer.
Sure, absolutely.
What is the difference between a resurgence and a second wave, and what are we in now?
Well, that would be, it's a difficult question to answer, and not specifically in my area of expertise, as I'm not a public health physician. I think that the terminology isn't one that I would be focused on right now. What I'd be focused on is the fact that we have increased numbers. And we all recognize that. We all need to understand that we have that, and we need to work in an informed way to approach that, either from focusing on outbreaks and putting those outbreaks, narrowing them down, getting our arms around them, and making sure that they don't spread. From figuring out, are there particular groups within the population that may be at greater likelihood to transmit, or particular venues or particular settings. All of those things are what I think we should be focused on, not what I think, what I know we should be focusing on right now. And that's the work that Dr. David Williams, Dr. Yaffe, all the medical officers of health are focusing closely on, really trying to understand what's going on so that we can learn from what's happening now, measure what's going on, and apply that in ways that would help to reduce the chance of continued increase in numbers and bring those numbers back down to our best way possible.
Follow up. Rob, follow up.
Okay, just to follow up. This morning, Health Minister Elliott said that we'll be up to 50,000 tests a day. I'm wondering when that is going to be and what is being done to guard against having so many tests done that there becomes backlogs in the lab, because that did happen.
So before I pass it over to the minister, I want to give a shout out to the pharmacy associations. I mentioned some of the big players, but you know who plays a critical role in so many towns across this province are independents too. And I know our team has been talking to the independent pharmacies too, and they've stepped up as well. It's just an amazing feeling, should be for all of us. The incredible job throughout this pandemic that our pharmacists have stepped up to the plate, and they're always there. They never shut down. They're always there for the medication, and I'm very, very grateful for that. But I will pass it over to Minister Elliott.
Within the next month or so. We don't have a definite date for it, but we're actively working towards that with Ontario Health. But of course, you have to have the testing and the lab tests as well. We have the supplies for it. We're ready to move forward, and we know that as we move into flu season, particularly with fall being upon us, that we're going to need to have those extra tests because people will be concerned, particularly parents of young people going to school, if their child shows any symptoms, whether it's COVID, whether it's the flu, or a simple cold. But we need to have the facilities available to test that so that we can all be safe and so that people will know in a very timely manner whether they're able to go back to school or back to work.
Thank you, everyone.
That's great. Thank you, everyone.